Hello, everyone. I'm here. Waiting for a minute.
Yep. Hi, this is Paul Malkmus, and welcome to the webinar for the Howea Diet. And we're talking about the connection between oral health and overall health. And I tell you, it's a powerful subject. And we have a speaker tonight, Dr. Gary McCown, who's been at the forefront of helping people overcome their physical problems by taking a look at their oral health, and we're excited for the information that he shares. But before we get into that, I'd just like to do a couple things of housekeeping. First off, as we go through the presentation, feel free to ask questions, and we'll queue those questions up, and we'll have a question and answer session at the very end of this program where Dr. McCown can answer all the questions. So feel free to ask the questions. Also, for those that are stay toward the end with the Q&A session, we'll be giving away three-month supply of oral health product. And so stick with us through it, and you'll be part of the drawing for 3 lucky winners of 3 months of oral health. But we bring these webinars to you on the first Tuesday of every month. And every month we have a real exciting topic, and as I said, we're excited about tonight's topic. Before we get going, though, I'd like to just go ahead and ask the Lord's blessing on our time this evening. Dear Lord, we just thank you for the opportunity to share this information, Lord, and we pray that you'll provide coverage for all the technology and for Dr. McCown as he shares the message, Lord, and that we have hearts and ears that can hear it. Pray that you'll guide everything we do and that we honor you through this presentation. In Jesus' name we pray. Amen. Well, Ann and myself have a little personal experience with Dr. McCown. He's actually been helping Ann for a while. And before we actually introduce Dr. McCown, we thought we'd go ahead and ask Ann to share a little bit of her experience.
Hello, everyone. Hi, Dr. McCown. It's nice to know that you're here.
Here.
So I got to meet Dr. McCown a couple of years ago. A mutual friend of ours named Olin Idle recommended him. And so what I went there for was I was having some difficulties with one of my breasts. And I could not understand, but I knew well enough that if I would go to him, he would be able to identify my oral health, and there would likely be some hope that there would be a connection between that and the issues with my breast. And sure enough, while I went there, he identified a cavitation, and I'm sure he'll explain to you what that is, an area where I had some infection below my gum line. And he was able to identify that, and he was able to help me by exposing the infection and ultimately removing it. And it was just, well, I can't tell you it was exciting because it hurt a little bit, but I can tell you that as soon as that was done and the infection pooled out and was cleaned up, my breast symptoms were quite a bit improved. And so what we did is we went ahead and went back another year because I thought, well, what that was an area where I had an old root canal, an old root canal, and then beside that I also had a wisdom tooth removed. So we had 3 other wisdom teeth, and he'll probably tell you that 75% of all wisdom teeth in your mouth will have some form of infection. They call it cavitation. Sure enough, I went back, and sure enough, out of the 3 left, he found 2 additional areas where the wisdom teeth had been extracted 30-plus years ago, and sure enough, there were some cavitations in them. So I'm so excited for you to be able to hear this gentleman. He has just a wealth of information, and I know that that could very well be the next step toward your ultimate healing. Thanks again, Doctor, for being here.
Yeah, and as Ann was indicating, with both visits and both treatments from Dr. McCown, she saw immediate improvements in her health in areas. In fact, on the way home from the first one, she started pushing on her breast, and she said it doesn't hurt anymore. And this was within just a few hours of the operation. So it was just the correlation between what she was experiencing physically and the oral health was undeniable. So without any further ado, though, I'd like to go ahead and introduce Dr. McCown. He has a great practice over there in Knoxville. And Dr. McCown, take it away.
Paul, and thank you, Ann, for your comments. Hi, everyone. A little bit of a prefix to all of this. There's research that says 93% of all systemic infections, there are 4 large groups of those infections. Periodontal disease, there are root canal teeth, which I think probably are the worst. Patients, which are an infection left over for extraction site.
Hey, Dr. McCown.
Yes?
Could you speak up just a little bit more? You seem to be trailing off a little bit from the phone.
Okay. Is that better?
Yes, much better. Thank
Closer
you.
to the phone. Okay, thanks. So anyway, there seems to be a direct connection between dental infections and systemic illness. So as a prefix to all of this, many of you may have heard of the Body Farm at the University of Tennessee. Very few people have actually heard of what is called the Bone Library, which happens to be under the University of Tennessee football stadium. And the Bone Library contains over 1,000 skeletons that have been donated to bodies that have been just cleaned down the skeletons that have been donated to the university, and that started previous to the Body Farm, actually. But anyway, I'd been involved with Dr. Bass, who started the Body Farm, and then after Dr. Bass retired, Dr. Murray Marks. And we got interested in looking at these skeletons relating to the research that I've been doing and results I've been seeing patients. So we looked at over 1,000 skeletons in the Bone Library, and Dr. Marks and I transported, it was like checking books out of a library, but we were checking skulls out of the Bone Library, 5 at a time, transporting them from the football stadium across the river to my office and taking x-rays of these skulls. Thought we'd do 100, but we quit at 80. Bottom line from all of that was, of those 80 skulls that we x-rayed, we picked 80 people that their health history was they died from cancer. Those 80 people, probably 30% had no teeth at all. They were denture wearers, and a lot of those people had cavitations or broken lips or pieces of mercury filling still in their jaw. And the remainder of those people, none of them had a full complement of teeth, and they all have some evidence of infections. So that's been the basis of this. We're still working on writing that, publishing that. Busy just treating patients. But it's been interesting 5 years. I've done this lecture for a lot of physicians, dentists, and tried to educate them to only see what you know. So when you look at this x-ray of the skull that's on the screen, there's evidence of cavitation, full complement, full mercury fillings, which are this x-ray of this skull. There are cavitations on the bottom right and bottom left. So I'm going to cover a lot of things: nutrition, focal infection, these root canals, cavitations, and mercury. Good. There are resources out there are not out of print.
Hey, Dr. McCown.
Yes.
Yeah, you seem to be trailing off again. Are you moving slides or meaning to move slides at this point yet?
Yes.
Okay. What slide
again?
are you? Yeah.
Health and nutrition. Health and nutrition. I just passed the skull x-ray.
So are we at the right spot yet?
What?
Are we at the right spot yet?
You're at 11 and I'm on 12. There you go. You're 13.
Okay.
12. So
okay.
A lot of you read these things about doing better, Paul?
Yeah, and just if we could just really encourage you to speak up.
Okay. Talk louder. Is that working?
Yes, sir.
Okay. So, I mean, one of my favorite things is you can't stay healthy on Coke and Twinkies. So eating a healthy diet is really important to any kind of health improvements. A lot of the research that I've studied goes all the way back to the 1920s from Dr. Weston Price. He examined a lot of indigenous populations from Africa and others around the world, and he found out that they were all healthy until they started eating the American diet, which is largely flour and sugar. So those are things to avoid. What was interesting about his research with all these 14 races of people is their diets varied widely, and they were all still healthy. They had no decay. They didn't need braces. They had perfect teeth, perfect jaw alignment, and everything. So it seems that you don't have to live on one specific diet, but it has come down to not. My thing is that if it comes in a cardboard box, you probably shouldn't eat it. You should eat fresh, healthy food. So the focal theory of infection is if you have an infection in one part of your body, it can spread to another part. That's the basis of dental disease causing breast cancer, strokes, heart attacks, all of these serious things that have. And the research is that 93% of all systemic infection can be traced to pre-existing dental infection. So it becomes, dental decay isn't just a local problem in your mouth, it's a systemic problem with basically a bad diet. It precipitates a lot of these dental problems. What's important to understand about teeth is they are small, healthy organs that have blood supply inside them. Not just a nerve inside a tooth, it is blood supply and nerve. So have a root canal done, lose not just the nerve and the pain goes away, but you also lose the blood supply. So my contention is that if you have blood pressure in your arm, you have blood pressure inside every healthy tooth. That's what keeps it alive. So probably one of my favorite sentences is, root canals are the only place in any field of medicine where you can keep a dead body part with no blood supply. It can really cause problems. So best thing to remember, we're looking at the inside of a tooth that's full of just little microtubules. There are enough tubules in one tooth to stretch across the United States. All of these are fluid-filled by plasma, which is the clear stuff in your blood supply that keeps teeth alive and healthy and clean because pressure from the inside to the out. Get decay in a tooth, the bacteria, because of mostly a high sugar diet, will eat through the outside of your tooth and get into the inside, and then the bacteria invade the inside of your tooth, and when it gets all the way into the blood supply, that's when you get an abscessed tooth. Gum disease is one of the others. This was the first anaerobic infection, and all of these dental infections that cause problems are anaerobic. That means these are germs that live without oxygen. So gum disease was the first one in the dental literature in 1998 that was linked to heart disease and heart attacks. All of these other infections, whether it's gum disease or root canal or cavitation, they're all the same bacteria that live without oxygen. So gum disease is probably one of the most common. It certainly can be heart attacks. The thing about gum disease or periodontal disease, it is the most common anaerobic infection among humans on the planet. 80% of the population has it. Heart attacks, strokes, low birth weight babies, and cancer. So periodontal disease is just another anaerobic infection. But This is a quote from past president of the Periodontics Association. Periodontal disease is a bigger problem than we thought, given what we know about the relationship between gum disease and other diseases. Taking care of your oral health isn't just about a pretty smile. It has much bigger implications for overall health and is therefore a more significant public health. I've learned that people that go 3-4 years without seeing a dental hygienist getting their teeth cleaned, they're more likely to develop systemic infections than people that nature. If you go to the hygienist, get your teeth cleaned, you get all pumped up about taking care of yourself, but this slide shows if you neglect to go back and keep routine cleanings of your teeth at least every 6 months for the average person, then it's easy to fall into that trap of gum disease, cause systemic infection. So, anaerobic infections caused by bacteria that live without oxygen. What happens is the toxic waste products of these bacteria are more dangerous than the bacteria themselves. That's what gets picked up by your bloodstream, spread throughout your circulatory system. What I think has made this complicated for dentists and physicians to understand is it doesn't cause the same illness in everyone. It picks on your genetic weakest link. A whole variety of illnesses that are caused by the same type of bacteria that live within your body that cause decay, that cause gum disease, that cause all these things. Bacteria that live without the presence of oxygen. They're just embedded in us. Like telling people that if you have gum disease and you got a hamburger stuck between your teeth and the germs eat all the hamburger, then the next thing they start on your gum because it's just all protein to them. Now you're looking at some photographs from the bone library. These are of abscessed teeth. What I learned, and one of the biggest things that got my attention after looking at all these skulls that Dr. Marks and I looked at, see a hole in the bone from an abscessed tooth, but what you don't see is how widespread that infection is. So what I've been telling dentists now for several years is what you can see on an x-ray of a tooth identifies an infection in an abscessed tooth. Look at the skull, it's really about 10 times worse than what you can see. So there are people that have root canals that tolerate them well. Some people don't. I'm getting to this slide right here. This is a drawing by Weston Price from 1925, and he talks about we would call absent susceptibility having a good immune system. Patients that are 70 years or older that have multiple root canals and they don't have any illness. But the majority of people, it's like a bell curve. I mean, really poor immune system. The rest of the population's in the middle. Lucky upper 10%, you can tolerate root canals, but most people can't. Probably 90% of the population will eventually some kind of infection develop from one of these big dental infections. So about this, root canal is the only procedure in medicine where you can keep a body part with no blood supply. Canals are worse than mercury or cavitations, and root canal infections. Picture of a bunch of root canals, 2, 3, 4, 5, 6, big infection on that lower right side of that. So the only thing you can do is remove these teeth before you're age 50 if you're in susceptible groups. Just root canal teeth that have been removed, and they all have this infection granulation tissue at the bottom of these failed root canal teeth, and that is your body trying to build a wall against this infection that's there. The problem is if you have no blood supply to the tooth, the body just can't fight these, so these can slowly get worse and worse and worse. So Weston said, don't think you can come to the rescue of a patient and remove the endangering tooth just before an attack of the flu or other serious overload. The only time to prepare their bark for the sea of life is if it's in your dry dock, not when it's in a... Don't wait till you're sick before you do something. So, cavitations, it's a common term. The big words are neuralgia-inducing cavitational osteonecrosis. These were described as pain-causing lesions, but probably only 10% of osteonecrosis means dead bone. All of these cavitation infections are a type of gangrene. So again, there are cavitations on this X-ray on both sides of the lower jaw. The rule is kind of, if you can see the outline of the tooth more than a year ago, then the bone never filled in where that tooth was moved, and it's harboring an... This is an actual slide of a surgery. Looking at a wisdom tooth area on the lower right of a patient, and the bone on the outside there is just, it looks like perforated. And normal bone doesn't look... actual gangrene coming out of a lower first molar cavitation, and actually green pus. This, the two roots here, the front root I punctured, and that's where the pulled out of there, and then I got the cyst out in the back one without. So I talked to Dr. Bocaux, who wrote the most modern textbook, and he told me, told him what I was doing and what I was seeing and what kind of outcomes I was getting, and he told me when you find the oil in these cavitations, you found the problem, and that is the toxic waste products. All these little black dots are just oily waste products from bacteria. So there it is, cleaned up. We like for them to bleed out clean, and close these up, heal remarkably quick, a day or 2 days at the most, very little pain. Depending on where they are, sometimes swelling, but not a lot of pain. This is what normal, healthy bone looks like. Nice, clean, smooth. All this patient's molar teeth had been extracted, but there's no cavitations and all. Still nice. Black dot there is nerve that comes out through your lip, branch of the nerve that goes out of the jaw. Another example of a cavitation in the bone library. Oh, lots and lots. For examples of pitted. This one was I don't know that this had a root canal or it's just an abscessed tooth, but it doesn't really matter. There's an infection at the top, the mental foramen where the nerve comes out. It's the bottom there. But the very bottom of the jaw, which is a lot like concrete, that infected tooth all the way through the part of the mandible on the gum disease looks like this. If you look toward the back, you can see where the bone gets smooth and looks nice and healthy, but right around these have gum disease, whole lower jaw in the front's infected. Other infection.
Dr. McCown,
Yep.
Are we all on the same slide? Are we on the right slide there?
I'm on the number here. On 49.
49, okay. And then if you could continue just to speak, if you could just continue to speak up close to the mic, sometimes you're fading in and out.
Still good right there?
Yes, thank you.
Okay. So this is an example here on this slide with an abscessed tooth, and you can see all the tartar buildup on these teeth. So this is a combination of an abscessed tooth and gum disease, double dose. One of the classics, root canal tooth, that the tooth's cracked and all the bone on the front of the root has disappeared. if you took an X-ray of that tooth, you would not be able to tell that all that bone on the front of that tooth was not there. These abscesses can create a hole in the roof of the mouth. Infections just build up pressure and hurt until they blow through the bone, and then the pain kind of goes away, and they just sit there and go in your heart and your brain. And the wisdom of Weston Price is good. No type of focal infection lesion of the entire body is comparable in danger to an infected tooth, because the defenses of the body cannot enter the tooth and annihilate the source of bacterial irritation. And there's no blood supply there. If you don't have blood supply, antibiotics can't get to the problem. Your own white blood cells can't get to the problem. Nothing gets there. It spreads and spreads and spreads and gets worse. Mercury's also not good. No amount of mercury can be harmless. There's been a lot of press about lead paint, and everyone knows arsenic is toxic metal, and mercury, but each one of these is 100 times more toxic than the other. So mercury in amalgam silver fillings is 1,000 times more toxic than lead. My favorite dentist from California, David Kennedy, he always makes this: mercury's bad, fluoride's bad. Fluoride's not bad in the sense that topically or just painting it on teeth to reduce sensitivity is okay, but swallowing fluoride's not good for you. Mercury's also in flu shots and childhood vaccines. It's called thimerosal, but it's really a preservative in these vaccines. A lot of discussion about whether thimerosal causes autism in children, and that debate still goes on. What I have learned is that 2-week-old babies don't need all these vaccinations. That if you wait until your children reach a body weight of 40 or 50 pounds, which is before they go to start in the first grade, they tolerate these vaccines fairly well. So just postpone is a good idea on having vaccines. I learned about a complete revision from Dr. Hal Huggins, who's called the father of modern holistic health, and said that the only way you can get patients well and expect good results is what he called a complete revision. That means healing gum disease, replacing the mercury fillings properly, extracting all root canal teeth, and surgically treating osteonecrosis or cavitations. Results really can be fairly dramatic. Before and afters of this lady's face. Is that showing up, Paul? This one's important.
Yes, it is. It's showing up.
Okay. This lady on the slide on the left was being treated for rosacea. She's on antibiotics to control this facial rash. She had a cavitation with a broken off piece of wisdom tooth in it that they completely gotten all the tooth out. In a year after I cleaned out the cavitation and got that broken piece cleared up, and she's off antibiotics. Pretty dramatic, and that quite often. So this is kind of for the dentist, this slide. Now that you know more, what can you really see? Learning to look at x-rays. On the left side of this, there's a broken off piece of a tooth in that jaw. Keep in mind that these skulls from the bone library, when the skull dries out, teeth just kind of fall out of the infections still show up. Another one, decavitation on the left side of that lower jaw as a just a little defect that never healed up. Another one, cavitation on the lower left of that slide. Oh, I see it. Back on the lower right side of the screen, there's a little piece of broken off tooth. Some tooth was properly removed. This one on the lower right, there's a piece of an old mercury filling inside of a cavitation. lots of things can precipitate these places not to heal properly. Again, cavitations on the lower right. You can see a hole in that jaw where the wisdom tooth used to be. Cavitations show up pretty well if you know what you're looking for. This one actually was probably an ameloblastoma on the lower right. That circular part probably started as a cavitation and transformed into an actual jaw. So all of us that graduate from dental school and medical school swear to what's called the Hippocratic Oath, and the short version of that is we as medical practitioners should do no harm. Certainly try to subscribe to that. So keep in mind that oral health is definitely related to overall systemic health. Mouth is not separate from the rest of your body. I wish the physicians would take it back. After the Civil War, they pretty much divided the body into the mouth and the rest of it and gave the mouth to we dentists. But physicians need to be looking at the overall health of the person and act canals when they medical exam. So root canals are an old treatment that should be eliminated except for temporary relief of pain. Tooth removal and modern dental implants are safe, effective treatments at about the same cost. Even removable partials are a healthier choice than root canals. So this came from a time when surgeons didn't wear gloves, and no one knew about sterile technique in the operating room. And the German philosopher wrote these comments about surgery in the operating room transformed back in the 1930s. All truth passes through three stages. First, it's ridiculed. Next, it's violently opposed. And finally, it's accepted as self-evident. Certainly, sterile technique has become standard of care in hospitals. 100 years ago, it wasn't at all. Time to change things. The last word from Weston Price: and truth comes only to a prepared mind. Thank you all for being here. Listen to me. I'll take questions in a bit. Paul, back to you.
Yes, thank you, Dr. McCown. It's
Okay.
Lots of great information. Lots of great information. Thank you for sharing it and for sharing your expertise. And just before we get into the Q&A, we just want to tell people, remind you that we have oral health chewable probiotic that's on special this month. And if you put in the promo for webinar, it's looks like a $5 discount, or free with a purchase of $125. So feel free to call the customer service center or go to the myhdiet.com website and take advantage of that. And we'll go ahead and take some questions. You know, Dr. McCown, you talked a lot about the problems, but what does somebody do? You know, it's really difficult. We've spent a lot of money on our teeth, and people are struggling. Some of us have even had all of our mercury removed, thinking that's going to solve the problem, but then, you know, we find that we're still experiencing problem, and it very well could be associated with our mouth.
Yeah. Two things, and there are several holistic groups nationally, and their call signs are IOMT, which is one of the earliest holistic groups of dentists and physicians. So it's IAOMT.org, and look for dentists that are holistic in every state by looking at that online. There's another partnership group with them called IABDM, IABDM.org, and look for dentists in your area by looking at those two websites. Okay.
Yeah, that's great resources. And, you know, we have one of our participants said their mouth is a mess, and I think, you know, that's not abnormal for people that are probably in their 50s and 60s and 70s based on dental practices back several years ago. But one participant here says, what should I do? Just have all my teeth removed and wear dentures, or what are the other options?
That's a multiple choice question, and it's hard to answer without seeing an X-ray. It varies from, you know, one small little chipped tooth to just a mouthful of, you know, 6 or 7 root canals and two ends of the spectrum.
Okay.
So I get those questions all the time. What do I do? And I'm like, I mean, my receptionist will say, we can't tell you anything until we see an X-ray of you.
And you really need to see a panoramic X-ray, don't you?
Really need to see a panoramic, yes. And that's just a good start. There are things that you can see on a live dental exam of a patient, and there are oral cancers that show up in the mouth on the cheeks. Don't show up on an X-ray, so it's very important to dental exam.
You know, some people here mentioned that they've tried thermographies in the mouth to identify. What are your thoughts on that?
Thermography helps. It's like an X-ray. It's just an extra tool. It can help to identify cavitations. Sometimes they're actually hard to see even on a panoramic X-ray, but the heat signatures from panoramic show that there is an infection, and it pretty well can track it to a certain part of the mouth. So those are good tools.
Okay.
They work real well as an alternative to mammography. Also, you can detect breast cancer on a thermal scan earlier than you can with mammography.
Okay. I have one participant that says, what if you're, you know, like in your 50s and you have one tooth that supposedly you're told needs a root canal? Should you rather just have the tooth pulled?
Yes.
And then what's the best option for fixing that so that there's not a, you know, the bite isn't off and there's not a hole there, a gap?
Again, it depends. I mean, the easiest thing is removal of partial. The most expensive is an implant and the crown. Several options. Historically, if you lose all of your back teeth and don't put anything back, it does not shorten your lifespan at all. If it's front tooth, it becomes a cosmetic issue, but the safest thing to do is get the tooth out and then deal with the cosmetic or the functional issues later.
How do you feel about implants? Are they dangerous or cause other problems?
I've been helped do the first implants that were done in Tennessee in '86. Lady had a car accident, lost all of her teeth. She had 5 upper implants, 4 lower implants, and 4 denture that I made for 30 years. And last year I had to replace the denture, and the implants are still fine. So I like titanium implants. There's a lot of discussion about they're bad, but I just, if they heal properly when they're first put in, I don't see any problems long term. I wouldn't be afraid. I mean, I had a root canal tooth pulled myself when I was 37 years old when I learned this. Ranged from heart arrhythmia to migraine headaches to just recurrent dental infections from this upper root canal. I had a bridge put in, but if it were today, rather than have 2 good teeth cut down and a bridge put in, I would have 1 implant.
Okay.
If it was my choice, I'd have an implant.
What do you think about oil pulling?
Oil pulling works. If you really learn how to brush your teeth, you don't need oil pulling or rinses or toothpaste at all. Toothbrush and water. Just push hard. Make your gums bleed every night. 3 weeks, they won't bleed anymore. I keep telling men, I like this. I just came up with this about 2 weeks ago. I tell these men that are skipping their cleanings, I said, look, when you get your oil changed in your car, you need to have your teeth cleaned.
That's pretty good.
That reminds me.
Yeah, that's a good way to keep track of it.
Maintenance. You know, you want to have your oil changed or you want to buy a new engine. Well, skipping cleanings is just going to cost you more down the pike.
No, you're absolutely right. Somebody with a lot of old amalgam fillings. Should they just go ahead and get them all replaced, or how could, only replace them if they're acting up, but then how do you know?
Hard question, but again, back to hereditary resistance to all these problems. A 70-year-old with a mouth full of mercury fillings and they're healthy and they're not sick, you can leave them alone. But that's only true of about 10% of the population. So if you're having health issues, you need to be thinking about whether it's coming through your mouth or not.
Yeah, makes sense. We have one participant who has on the lower right side has a hard lump that won't go away. The dentist says that it's bone growth and nothing to be concerned about. It doesn't hurt. Do you have any thought on that without seeing the patient or the X-rays?
There's a lot of hereditary bone growth, particularly under the tongue, that are called exostoses. Hereditary, and they're benign. Again, dentists would have to look at it to tell you. They can occur on the outside, but they're more common underneath the tongue on the inside of the lower jaw. Can be in the upper midline of the palate. Some people have them all over the bone around their teeth, but it's a hereditary thing that doesn't need to be treated.
Is there a good book that you can recommend for restoring the whole health of the mouth?
Yes, there's a new one out that came out last year that's the best and the newest. It's called The Toxic Tooth by a dentist from New York named Kulacz, Kulacz, I think. Buy it on Amazon. Toxic Tooth. Current.
If an infection is present in a root canal, will extraction take care of the problem?
Yes. You have to take the tooth out and not quit there. You have to clean the bone out also.
Would a normal dentist and even biological dentist understand that?
Biological dentist would, yes.
Could you repeat the holistic organization's website again?
Sure.
Looks like some people missed it.
Okay. IAOMT.org. The other one is IABDM.
And you mentioned the option of an implant and crown, somebody thinks. That sounds like a root canal and crown, and they're asking what the difference is.
Well, the difference is if you put a titanium implant in, it's not porous. It doesn't have any blood supply. The discovery was made by accident. And there was a physician from Germany that putting a little glass window that was screwed into rabbit leg bones. What he was trying to do was be able to put a microscope on this little lens into the blood supply and just watch the blood go through. And he did all this experiment, and then he couldn't get the little titanium holders for the glass window out. The bone grew to them, and that's how implants started. And Dr. Bronemark actually met him, went to Toronto to be trained in implants when he made that discovery. Pretty cool. It's just an accident.
Wow.
But teeth are porous. Implants are solid. And also the interesting thing is gold and mercury fillings create a battery and an electrical charge, and titanium does not. It's electrically neutral. It doesn't cause a lot of the other headaches and other problems that gold and mercury. Two different metals in an acid is called a battery. That's how you start your car every day. Start your car with titanium. Doesn't cause a charge. That's why they work so well.
How does somebody know if they have mercury in their mouth?
Ask a dentist. It's obvious on an X-ray if they do. And if you got silver fillings, they're half mercury.
Yeah. Can you reverse teeth sensitivity naturally, and if yes, how?
That doesn't relate to all this topic, but most of the time, yes. I call it bouncing your tires. It's usually hard. Tooth sensitivity, 90% of the time, you're bruising the ligament that holds the tooth to your jaw. It's the same thing. It's like a sprained ankle around your tooth, bruising a ligament. So if you got one tooth that's out of place, it's hitting too hard, it's going to get sore. Cold sensitive, it can be light sensitive, but that's 90% of it is bruise.
Yeah. One person said they were brushing too hard and they had receding gums because of it, and then somebody else asked about deep cleansing. If they have that done, do they need to continue having that?
Yes to the second question, and the first question, if you're brushing with toothpaste, you're causing the gum recession and the notching of teeth. Telling patients to just brush with water and then brush their tongue with toothpaste. Tongue will grow back, teeth won't. The abrasion from toothpaste that causes the issue.
Okay. Trying to read through the rest of these here. What type of tooth restoration do you recommend when there is a cavity, but the tooth doesn't need to be pulled?
Composites, basically they're called plastics, but composites are a mix of little tiny quartz particles, quartz rock, and plastic. Been them for 30 years. Durable. They don't cause an electrical charge. Well, you just can't do a whole crown with one.
Mm-hmm.
The smaller the hole, the better composite plastic fillings work.
Okay. Somebody had their root canal, their wisdom teeth removed when they were young, and they were protruding into the sinus cavity. They never had a problem prior to having them removed, but then the problems have been ever since. Any thoughts on how to fix that and reverse it?
Sounds like a cavitation from an upper extraction. Most of the time, if it's really there, a panoramic radiograph will show an infection in the sinus. It'll just look cloudy instead of normal. Healthy sinus just looks like a black hole on an X-ray. If the sinus is infected, it'll look cloudy. And
you recommend just brush? Go ahead.
I'm sorry. Well, I wanted to say about the upper ones. They're harder to diagnose upper cavitations than lower because they both as well on an X-ray. It's real common to see infected sinuses from root canal.
Mm-hmm. Do you recommend water picks for daily teeth and gum care?
Yes. Water picks actually work really well. And I did some research on water picks and bought one, and the cheapest one from Amazon works great. Strangely enough, just water itself will kill germs because it dries them out.
Okay.
They work well.
Yeah.
Better than oil actually, I think.
Yeah, and Ann's been using a hydrofloss for several years now, and every time she's gone to the dentist, they've always commented about how healthy her gums are from using that hydrofloss.
Yeah, that's just a water pick brand.
Yep. Well, we've been a lot of questions, and we really appreciate all your time, but we're right at the end of our time limit. So thank you, Dr. McCown, for all of your information. And we really appreciate that your number's been on your address has been on the screen there, and so we'll be getting that out. And Chris, if you're listening, can you pop on with the winners for tonight? Didn't see where we have them listed. Chris should be pulling up, but we'll be having another webinar next week. On Slack, there we go. Okay, so the winners tonight are Joel Stacy, Celia Turner, and Ruby Meister. And so each of you will be receiving a 3-month supply of oral health probiotics. And we appreciate everybody for being on the call with us tonight. Hope you received some good information. This call was recorded and will be available on our website within just a few days, and we'll be sending you out an email to let you know. And our next webinar is the first Tuesday in May. Wow, it's amazing how quickly the year is passing. So thank you all for joining us. Thank you again, Dr. McCown, and for all your great information, and we look forward to seeing you again real soon. And good night, everyone.
Paul. Thanks for having me.
Yes, sir. Thank you.
All right. Goodbye.
Bye-bye.